let me ask you a question, Dr. McCawley, and you guys can jump in on this. Evidence is important. What kind of research has been done around using microscopes in your practice?
There's a fair amount of research. I think the most powerful piece of research was done by one of the founders of the microscope and his colleague, Dr. Kais and Rams. They did a study where they followed a group of patients for 5 years, roughly. The ones that had spirochetes and white blood cells had 10 times the risk of bone loss over that 5 years. And the ones that had no spirochetes or white blood cells had 0 bone loss over the next 5 years. And there's several studies also showing that when you have spirochetes, you also have some other important bacteria, all right? And that's a delivery from FedEx. Can't shut that down. Okay.
Tis the season.
Tis the season. All right. So basically, we have solid research that supports the use of the microscope. That if you have them, you got 10 times the risk of bone loss. If you don't have them, you got almost 0 risk of bone loss.
Wow. That's powerful.
Now, bone loss isn't the only issue here. I may have a patient who comes in and doesn't have bone. Sometimes patients can be actually resistant to the infection, just like some people are resistant to catching a cold, others are more susceptible. But they may have these they may have these bacteria, they may have these pathogens under the gum, bleed, but no bone loss. Well, should these people be treated? They may not have bone, but they've got these parasites, they've got these pathogens getting into the bloodstream, going to their brain, going to their heart, going to their lungs, going all over their body. In my opinion, that infection will be eliminated as bone or not. So we're looking at 2 things. We're looking at gum disease causing bone loss or periodontitis, and we're looking at gum disease or gum infection causing 57 or 58 or 59, or certainly contributing to huge numbers of systemic diseases, Alzheimer's being the latest and maybe the most severe.
Wow.
Here's an illustration that shows how the bacteria get throughout the body. We show this to patients, all right? And then we show them this thing where it increases the risk of heart disease, first heart attack, by 28%. Wow. So